It's been a very informative and interactive 3 days. And I have a lot of thoughts, ideas, and questions that are settling in my head and circulating that are going to need to just sort of fall into place after we leave today. There are 3 main ideas and needs and advancements that sort of came to the top in my mind that were repeated over the course of these past 3 days. And those I will take back with me, especially to CDC. And these actually are things that we've already acknowledged at CDC and have been working on and know that we have to work and advance further. Those are diagnostics, genetics, and communications. So those are things that we will be working on and we hope to partner and work on. But I have some other thoughts and ideas as I've heard everybody speak over these past 3 days and the conversations we've had in the hallway and over meals. So I'd like to share some of those with you. First, just so you know my background, because it is different than many people here in the room, I am a microbiologist and an epidemiologist by training. I've worked in public health for about 20 years now, and 17 of those years have been focused on antimicrobial resistance. I've worked at the CDC and in healthcare for about over 7 years, and now at the CDC on enteric, zoonotic, and environmental issues for about 2. In these past 2 years, I've met many intelligent people doing amazing work on the reduction of antimicrobial resistance in both people, animals, and even the environment now. I have seen a lot of people coming to the table with outstretched hands instead of folded arms. What I do know is that we do all care about our loved ones, our pets, our livelihoods, the food we eat, and the environments that we live in. We recognize that antimicrobial resistance is a serious concern. We want to ensure that antibiotics are available and effective when we need them for sick people and for sick animals. We acknowledge that any use of antibiotics does place selective pressure on bacteria to find a way to survive, which means to potentially find a way to acquire resistance. And each decision to use antibiotics should be an active one, where we weigh the benefits and make sure that they outweigh the risks for both resistance and side effects. We don't know all of the exact pathways to resistance, or which is the greater pressure over the other. But we do know there are multiple factors and pressures and drivers that come from many angles. Humans and animals have complex microbiomes, which include organisms that can be commensals and or pathogens. And these can carry resistance genes and plasmids. Because humans and animals carry some resistant pathogens and pick others up along the way with interactions from other people, other animals, and the environment, we know that the best protection is precaution to minimize more acquisition, especially when defenses are low and risks are high. Specific cases at a high level are healthcare interactions for humans and close congregation for humans living together, animal husbandry, and close congregation for animals as well. There is a lot we know about keeping humans and animals healthy. Fresh air, clean water, safe environment, balanced diets, a healthy microbiome, and strong immune systems, infection control practices and biosecurity, and antibiotic use and other treatments when illness does arise. We do know, and we've talked about it, how hard it is to change behavior and to break a cycle, to step out of the comfort of the way we've been doing things and to take that chance. What if it doesn't work if I try something new? But advancement doesn't come without that leap. To know true source of the problem and to make better decisions on how to treat when there is a pathogen, we need better, faster, more accurate, affordable diagnostics for humans and animals to inform and focus our response, including when it requires a decision to use antibiotics. What all of this shows me is that we have much in common. that we can't fix the need for or use of antibiotics in humans or animals or plants and expect to see a difference in circulating resistance if we don't address as many angles as possible. So we are all in this together. We can't succeed without each other. We each know our space and area of expertise, and that is where we can make our improvements. This is how we will make a difference. But we still need more research, accurate baseline data, and data to track our changes, ongoing collaboration and improved communication, options and alternatives, to be open to new ideas, understanding of obstacles and willing to share our stories, support, trust, patience, perseverance. There is no simple or easy solution. The problem is complex. And it isn't just about keeping humans healthy, but also about keeping our pets, our environment, and our food supply healthy. And all this we do have in common. So for all these reasons, this ongoing partnership is crucial. By continuing this conversation, we come to know each other better, and that leads to increased trust. So I hope that we can continue this relationship and partnership so more progress can be made along the way. Thank you.